Good morning. My name is Jason Johnson. I'm with Focus Counseling and Therapy in Daphne, Alabama. I'd like to do a brief video today on the importance of the interchange of psychological medication and therapy. Okay, most people go to therapy or they get a medication because they are feeling dysfunctional in their life, they are feeling distress in their life, or they may be putting them or doing things that are putting themselves in danger, so they seek treatment. Here's an example. Someone is in a relationship, and the relationship is just making them depressed. And when their loved one or individual comes home, they're just depressed, and they feel despair, they feel dysfunctional, and it's just distressing for them. So they are prescribed a medication that helps with the depression, to help raise the serotonin level. Now, that medication may help with the symptoms of the depression to where they don't feel the depression anymore. Now, remember, depression isn't necessarily sadness. Depression is exactly that. It's where we depressed. Basically, where things that used to give us joy do not, and we have other symptoms such as we have a hard time sleeping, it's hard time eating, etc. Well, the medication, yes, it can help treat that. It can help treat those physical symptoms, but it doesn't necessarily treat the root cause of the problem. What is causing the depression? What in the relationship is occurring, whether it's internally, whether it's interpersonally or relationally, that's causing the depression? That needs to be addressed. That is where the medication comes in to treat the symptoms, and where the therapy comes in to treat what causes the symptoms and how to come up with ways to adapt and to cope with that situation. Give you another example. Let's say anxiety. I am someone that when I am around certain people or I am in certain situations, I feel a lot of anxiety. And that anxiety is distressing for me. That anxiety causes dysfunction in my life that impairs me in some way. So I get prescribed a medication. And the medication, once again, it will treat that symptom. It will help the symptom of the anxiety to lower, which is good. And then therapy comes into play because therapy helps to identify what is it that is causing the anxiety. What situations, what triggers, what is it that causes anxiety in an individual's life, and learn ways to cope and to deal with it. Because the goal is that nobody wants to be on a medication for the rest of their life. So if you are in some type of psychological distress, some psychological dysfunction or danger, maybe you need medication to level out. But that can do just that. But the therapy is where you are going to help correct the symptoms. You can think of it almost as like in regular medicine, where somebody has a bad leg and they can take medication to treat the symptom, but yet they still need to go to physical therapy to work on it so they don't stay on the medication forever. And sometimes they do need to stay on the medication forever. There are certain psychological disorders, like, let's say, schizophrenia, which is an organic disorder in the brain that usually the individual does have to stay on medication for the rest of their life. And I don't want to underestimate or underemphasize the importance of exercise and also diet in our life to help with symptoms that we might have psychologically. So there you go in a nutshell. Very simple. And if you are ever prescribed medication for a psychological condition, let's say depression or anxiety, understand that that medication treats the symptoms, but it doesn't necessarily address the root cause. And that's where therapy can come in and be so helpful. And that's why they can work so well together. Psych meds and therapy can help individuals address situations in their life that are causing them despair, dysfunction, or distress. If you'd like to learn more about this, you can go to my website at jjohnson.com, jjohnsoncounseling.com, or you can go to my email me at jjohnson@jjohnson.counseling.com, or you can call me at 251-307-5338. So I thank you for listening. It's an important topic. It's something that's increasing, and it's important to have a clear understanding of where medication and therapy come into play and how they work together. So thank you again for listening, and have a great day.